must be an incredible number of people that are stuck in this limbo of they can't get help because they can't get help.
1 in 6 South Carolinians has no health insurance. Each day, many are forced to make difficult decisions.
It comes to the point where either I pay my light bill, I get my medicine, or I leave car payment off, or I get my medicine.
After an accident left Charles Dees disabled and uninsured, he seldom sought care for the pain from his injuries. However, when cancer threatened his entire ear, he knew he had to do something.
It was going downhill real bad, and I depleted everything I'd owned. I didn't have anything. And honestly, I didn't think there were nobody out there that would help me.
Someone told him about Mission 2011, a free 2-day medical event. George caught a ride to Columbia and spent the night in line to see if someone at the clinic could help him. He saw a doctor at Mission and was referred to an Access Kershaw staff member who has been a lifeline for Charles, helping to coordinate his care.
I was hard-headed, but when I run across these people, it just changed my whole attitude toward medical in general. It just turned me around.
Access Kershaw is just one of 10 networks created with help from AccessHealth SC. The 10 networks are collaborative efforts consisting of many diverse partners, helping uninsured and underinsured persons access the care they need.
I'm 59 years old, and I've got more service from these people than I have in my whole life, in my medical. And I've needed some help. This is serious times for me. I've depleted everything I had. I didn't have any money, no property, or nothing, and they helped me because, you know, I'm a person and they believe in the people.
Since AccessHealth SC was created in 2008, community networks have provided more than 11,000 South Carolinian services, valued at more than $11 million a year. And that investment is making a tremendous difference in the health of clients. Because of local collective efforts in communities, data shows that for AccessHealth clients, emergency room use is down an average 19%. Hospital admissions are down more than 31%, and hospital stays are 16% shorter. A subgroup of hypertensive and diabetic clients is also experiencing nearly 30% lower blood pressure readings and 25% lower blood sugar levels than before they entered the program. These results demonstrate the collective impact of providers and programs working together in communities to improve health. And more timely access to needed services adds up to lower healthcare costs. In 2012 alone, AccessHealth Partners saved South Carolina more than $2.5 million in unreimbursed hospital costs.
Health has improved. We're having better outcomes, and from my perspective and from a financial perspective, it's been an amazing program because we've seen a 66% decrease in utilization here in the hospital from those individuals that participate. We've seen a 47% decline in cost for individuals that are participating. So for every dollar that we spend, we're saving $4.61.
Before enrolling, most clients lived with poorly managed and costly chronic conditions because they are uninsured.
Trying to function without any kind of care, my life basically became an ongoing battle of avoiding what my known triggers were.
It was routine blood work during his first visit with a physician through Mountain Lakes AccessHealth that confirmed that George Fisher has type 2 diabetes. He learned that some symptoms he had attributed to epilepsy were actually the result of undiagnosed diabetes.
My daily average has dropped from 182 when I was first diagnosed, my daily blood sugar. My daily average is now right around 102. First started with AccessHealth, this jacket used to be tight when I would put it on. And now I've lost about 61 pounds.
Lisa Baker had just been diagnosed with diabetes when she lost her health insurance. She was not able to afford medication and routine medical care for more than 3 years.
Before I started Access, my A1C when I was in the hospital was 11. A year later, this January, it's 6.6. And yes, I am on some medication, but it's dropped also because of what I've learned.
Both Lisa and George benefit from chronic disease case management. They receive education about their conditions, needed medications, and connection to hospital-based wellness programs.
What I've learned about diabetes through AccessHealth has changed my family's outlook on health. My husband also found out that he is diabetic also, and we just from the classes I've started teaching my husband, my son.
So I could see why individuals that come through our network and our system may feel that they are being cared for in a way that shows better quality of care, or that people care more about them, because the focus and the model is quite different. It truly is patient-centered care. When you have patient-centered medical care in a medical home, you truly are looking at the whole person, the whole picture.
It's that constant follow-up and case management services, as we like to refer to them, that is really truly making a difference. And not just because we hear people say that, but because the numbers show that as well.
But in addition to the doctors I've seen providing excellent care, the nurse case manager here at Mountain Lakes kept up with who I saw, what I saw them for, and who I might need to see next.
This model of care thrives on collaboration. By working together, partners accomplish much more than if each worked alone. That is good for the partners and good for the community.
The partnership has increased our capacity. We're able to take those patients that require a 1-hour visit, a 1.5-hour visit, and refer them to AccessHealth or Access Kershaw and have them do special visits with them.
To get physicians involved was really an easy buy-in. Physicians are, they have a huge heart and they want to help. That's why they got into medicine in the first place. And so this makes the physician's job a little bit easier. They know that when they serve that patient, number one, they're serving those in need because we've already qualified them. And number two, by the time they see the physician, we've already helped them access social service resources, community resources, so that they can treat the medical problem when they get there.
All physicians take care of patients who are uninsured. Well, AccessHealth takes all that burden off of us, and they say, doctor, you be a doctor. It feels good to go home at the end of the day and know that you took care of somebody that otherwise wouldn't get care.
AccessHealth teaches clients to become their own health advocates. They also work with clients on needs that may not seem directly related to healthcare, but do impact health and quality of life.
They actually helped us help my son apply to college. We had no clue how to do that. They helped me apply for a hearing aid. We'll be getting reading glasses. So they combine your whole life in how to better yourself. What I've learned about diabetes through AccessHealth has changed my family's outlook on health, that not that the outside world is supposed to take care of us. It teaches us how to take care of ourselves.
Here, they don't make you feel like they're giving you a handout. They're giving you a hand up, and they make you feel like a person.
I go to bed every night, I say a little prayer for everybody, and I thank the good Lord for everything that I got and that He's given to me. And I thank Him for these folks also, and wherever they come from, whoever the good Lord give power to put them here, I'm glad they were here for me, and they could be here for other people also.
A little over a year now, I've gotten back to the point where I actually do care. I do see a future. There is hope. There's something to look forward to again.